Yes, good evening everyone. Welcome to One Shot series. So today's topic is forensic toxicology. As you know, toxicology is a very important component of forensic medicine and toxicology. Around 25 marks in your exam. There are many important topics like snake bite is very important topic. One very commonly asked topic is heavy metal poison, then organophosphorus poison and all. In today's session, we are going to discuss about one very important, very common suicidal agent in farmers, that is basically OP poison. Am I audible and visible, guys? Yes, say Rakesh. Rakesh, are you there? Vanshika? Yes, okay. OP poison. OP poison, that is basically organophosphorus poison. It is very common insecticide. The poisoning can be suicidal, especially in farmers. It can be homicidal, rarely homicidal, so because of the very bad taste. Sometimes it can be accidental because it is lipid soluble. It can enter through the skin into the systemic circulation. These OP compounds are classified into alkyl phosphates and aryl phosphates. The alkyl phosphates examples are malathion. Aryl phosphate, the example is parathion. The small dosage, around 500 mg to 1 gram, can lead to death. In parathion, 175 mg, even one drop through the skin can lead to death of the person. Yes, Rakesh and others. Fine. So let's see OP poison. The OP that inhibits acetylcholinesterase enzyme. It inhibits acetylcholinesterase enzyme irreversibly. This word is important. The carbamate inhibits reversibly. This OP poison that inhibits irreversibly. So there is an aging of the enzyme acetylcholinesterase after 48 hours. That's why the prolidoxime and diacetyl monoxime should be given within 48 hours. It inhibits acetylcholinesterase enzyme. So as you know, acetylcholinesterase enzyme of two types, true cholinesterase and pseudo cholinesterase. The true cholinesterase present in the RBC, pseudo cholinesterase are present in the plasma. If they ask you an exam, the investigation of choice, the answer must be true cholinesterase, which is present in the RBC or in the gray matter. The investigation commonly done, that is basically plasma cholinesterase. Okay. Then what is the fatal period? The fatal period starts with the 30 minutes to 2 hours. The mnemonic for clinical feature is SLUDGE-MTF. All this clinical feature because of inhibition of acetylcholinesterase enzyme. So when this enzyme is inhibited, there will be increased levels of acetylcholine. As you know, acetylcholine is a neurotransmitter of parasympathetic system. What are the clinical features? It starts with the SLUDGE-MTF, that is S for salivation, S for seizure, S for sweating. So try to understand sweating, seizure, salivation, increased secretions are the features of OP poison. All the secretions. So it can be secretion from the lacrimal gland, salivary glands, or GI secretions. All the secretion increases because of the increased acetylcholine level. The receptor is M3 receptor, as you know. Okay, yes. Then L for lacrimation. In lacrimation, try to understand there is one word known as Chromodacryorrhea. The Chromodacryorrhea seen in, your answer must be OP poison. Red color tears because of the presence of porphyrins in the secretions. Okay, Chromodacryorrhea, red tears. This is very commonly asked MCQ. Then U for, that is urination. D for diarrhea. G for gastric upset. E for emesis. MTF, M for meiosis, muscle cramps. T for tachycardia. Then fasciculation. Meiosis is seen in OP poison. Can anyone tell me what are the conditions in which mydriasis is seen? Mydriasis. Mydriasis means pupil dilation. My question is very simple. What are the conditions in which mydriasis is seen? Yes, good evening, Manjunath Datta. Can anyone tell me? Mydriasis, Manjunath Datta, Rakesh, Samir, Kumar. The mydriasis is commonly seen in certain poison. Like example, Datura poison. Which consists of atropine, hyoscine and hyoscyamine. In case of cocaine poison, scopolamine poison. So in all these conditions, so there is a mydriasis. If they ask you an exam, pinpoint pupil, your answer must be that is opium poison. That is morphine poison is the correct answer. Good. Datura, correct answer. Dev, that's great. TK. Okay. So there can be tachycardia and fasciculation. So the next comes is the management. Before that, diagnosis by doing some bedside tests like plasma cholinesterase or RBC cholinesterase and other tests. So management start with the ABCD. That is airway, breathing, circulation and stabilization by giving some drugs. The very important component is remove the patient from the site of poisoning. Remove the clothes, wash with the soap and water. The very important component is gastric lavage. Gastric lavage along with the activated charcoal. Can anyone tell me what is the preferred position of gastric lavage? What is the preferred position of gastric lavage, guys? Manjunath Datta, Dev, left lateral position, right lateral position, supine position, prone position. What is the preferred position? Your answer must be that is left lateral position. Gastric lavage is contraindicated in case of corrosive poison, especially in case of alkali poison or the acid poison, like example sulfuric acid, except carbolic acid. Okay, so this is very, very important. Left lateral, correct answer. Okay. Then activated charcoal. Activated charcoal is a physical antidote that binds with the pore that present in the stomach. It inhibits the absorption of the poison. The dosage is around 1 to 2 gram per kg body weight. So this is the one important component. Then the drug of choice. So the drug of choice is atropine. So loading dose is around 2 to 4 milligram IV. So it is given IV. Atropine, as you know, it is a antagonist of parasympathetic system. It acts on nicotinic and muscarinic receptor. It inhibits the action of acetylcholine. So atropine given 2 to 4 milligram IV till atropinization. Okay. So till atropinization. Can anyone tell me what is the therapeutic endpoint of giving atropine? What is the therapeutic endpoint of giving atropine? Because atropine overdosage also can lead to toxicity. At certain period, at certain time, you need to stop the atropine. What is therapeutic endpoint? Yes, Rakesh and Menak Dutta. The therapeutic endpoint is basically a dry mouth, or when secretions become dry. So dry secretion or dry airway. So that shows the therapeutic endpoint. Then you can start certain cholinesterase reactivators, like example prolidoxime. Or diacetyl monoxime. So try to understand, these drugs are given. So these drugs are given within 48 hours before aging. So normally aging of the enzyme occurs at the 48 hours. Should be less than 48 hours. And this diacetyl monoxime can cross blood-brain barrier. So that is better than the prolidoxime. The question asked in the exam, diacetyl monoxime is better than prolidoxime. Why? Because it can cross blood-brain barrier. It's a very important point. Then here, dry mouth, dilated secretion, airway, Menak Dutta, good. Actually, what is atropinization? Atropinization is a condition where there is a sufficient amount of the antagonist, so that can act against the OP poison. Okay, so balance we call it as. So atropinization is a therapeutic endpoint. Therapeutic endpoint of giving atropine into the body. Okay, then there are seizures, so you can give diazepam. So this is very commonly asked in the exam. So you need to start with atropine till atropinization, then prolidoxime, diacetyl monoxime, then finally diazepam. So this is very commonly asked. Now here is one more very important question. Can atropine reverse muscle weakness? The question is, can atropine reverses muscle weakness? Yes or no? Muscle weakness is very common in OP poison. So what happens to the muscle weakness after giving atropine? Does it reverse or it has no effect on muscle weakness? Yes, guys. Ashley, Menak Dutta. Come on. Try. No. Rakesh is telling no. Atropine does not reverse muscle weakness. This is very, very important MCQ. Okay, ho gaya? So this is okay. Now comes is the medicolegal importance. So what is the medicolegal importance of OP poison? MLI. Medicolegal importance, it is one of the suicidal agent. Suicidal. It can be agent of accidental poison, especially in farmers or the workers who handle insecticide spray. Then rarely homicidal, but it is not an ideal agent because of the taste. So it has the phenolic taste, the bitter taste. Then diagnosis and treatment is very important. It's one of the examples for reasonable skill and the care. So when you are not treating the patient properly, especially OP poison with the atropine, it can be an example for medical negligence. Medical negligence. Okay? Under the section 106 BNS. Yes, good. Manjunath Datta, no effect. That's great. Chalo, ho gaya. So there are many MCQ guys. So I'll just repeat. OP poison inhibits irreversibly. Point number 1. It inhibits acetylcholinesterase, true cholinesterase as well as plasma cholinesterase. The second MCQ. Third MCQ, what is the fatal period? 30 minutes to 2 hours. Then the clinical feature. So salivation, lacrimation, urination and all. Then fourth MCQ, Chromodacryorrhea. Then meiosis. In exam they'll give you mydriasis. Then comes his management. Drug of choice is atropine till therapeutic endpoint. Mydriasis occurs in datura, cocaine, scopolamine poison. Then the question can be asked about what is medical negligence. That is 106 BNS. One example is not treating the patient, especially OP poison, with the proper medical care. Not giving atropine can be medical negligence. So then this OP poison classified into alkyl phosphate and aryl phosphate. Alkyl phosphate, the best example is malathion. Aryl phosphate, the example is parathion. I hope you understood this. Okay. Any doubt in this, guys? Any doubt? Manjunath Datta, Rakesh, Dev? Okay? No. Now look at this. This is atropine sulfate. Atropine sulfate is the drug of choice. So it is also used in, you can see here, nerve agent. Nerve agent. Like example, VX, serine, sabine, all these are nerve agents. In nerve agents also, the same drug of choice, that is the atropine. You can see here atropine 0.6 milligram per ml. I said 2 to 4 milligram that is given IV. Yes, Ashley, that's great. Then look at this. This is prolidoxime. Can anyone tell me what is one contraindication for giving this prolidoxime? Can you name one contraindication? Yes, guys. So prolidoxime is a cholinesterase reactivator. What is the contraindication? Yes, come on. Manjunath Datta and others. Contraindication batao kya hai? Prolidoxime is contraindicated in carbamate poison. Because when you give this cholinesterase reactivator in carbamate poison, it can increase the signs and symptoms. It increases the toxicity than antagonizing the action of acetylcholine. So that's why it is contraindicated. Carbamate poison is the yes, good answer. Then there are some MCQs are there. Basically, very important poisons related to forensic toxicology. Very interesting 10 questions today. So all of you guys, shall we start the question and answer type? Say yes or no. Yes. Yes, Manjunath Datta, Rakesh, Ashley, Dev. So the question number 1 is very important question and a very interesting question also. The history is a 25-year-old fisherman came with a history of nausea, vomiting and dyspnea. So difficulty in breathing. Following consumption of liver and gonads of a fish. So this is the gonads of the fish. What is the most probable toxin that is leading to this condition? You know, most of the fishes, they are good. They are They are basically poisonless, we call it as. But there are certain fish poison which are very toxic, which can act on the sodium channel. It can inhibit the conduction of action potential, nausea, vomiting, seizures, and death of the person. What is that poison we are looking for in this case? What is this? Can you try? It is not mercury. It is not mercury. So this is basically a fish poison, puffer fish. The puffer fish. So the toxin is Tetrodotoxin, which inhibits sodium channels. So the answer I wanted is puffer fish, not the mercury poison. It is puffer fish, one of the most poisonous fish. Okay, most toxic one, puffer one. Okay, Rakesh, very good answer. You are right. The second question, look at this. This is the puffer fish. The gonads and the liver of this fish is very, very fatal, very dangerous. Okay, all of you write in the chat box, puffer fish. Rakesh, you write puffer. So this is about question number 1. The question number 2, the very interesting question. A 48-year-old male suffering from depression. As you know, depression is one of the most common cause of suicidal tendency because of the love failure in his life. Golfer killer was mixed with the coffee and it was taken. He presented with the tachycardia, BP 170/90, hypoxia and hypercapnia. On examination, so this is the picture. You can see here sustained contraction of all the muscles of the body at a time. What is this basically? There is one more picture here. Look at this. The two pictures. In picture number 1, you can see spasmodic contraction of all the muscles. We call it as devil's smile, risus sardonicus, opisthotonus, pleurosthotonus, emprosthotonus and all. The cause of death basically respiratory failure. Can anyone tell me what is the poison in this condition? Chronic OP poison nahi hai beta. OP poison nahi hai. So this is not OP poison. So this is basically devil's smile is there. Devil's smile. That is risus sardonicus, point number 1. The point number 2, there is opisthotonus. Opisthotonus. Sustained contractions of the body. All the muscles of the body. Pleurosthotonus, emprosthotonus. So this is risus sardonicus. So what is the condition, guys? It is not zinc phosphide. Manak Datta, no, it is not zinc phosphide. This is basically strychnine poison. So whenever word risus sardonicus, opisthotonus, pleurosthotonus, emprosthotonus, respiratory failure, bitter in taste, spinal poison, nux vomica, your answer should be strychnine poison. The fatal dosage is 1 seed. The fatal period is around 2 to 3 hours. And it resembles like tetanus. Okay? So the answer is strychnine poison. Ashley is telling, sir, what is opisthotonus? Opisthotonus is backward bending of the body. Okay? Backward, arrow-like bending of the body. So because of the contraction of the extensor muscles. So backward bending is opisthotonus. Sideward bending is basically pleurosthotonus. The forward bending known as emprosthotonus. Devil's smile, the contraction of the facial muscle, you can see here. So facial muscle contraction, which is known as devil's smile. Okay? Okay? Good. Crush seed is 1 crush seed. That's great. Take it. Then Then the question number 3, 42-year-old male, the stomach shows 3 polythene packets. So case of sudden death in airport. So a healthy male, foreigner, found dead in airport. He was found dead unconscious and he was brought to the hospital. The autopsy was conducted under 194 BNSS. During postmortem examination, what we found, 3 polythene packets like this. So 1, 2 and 3. On chemical examination, what we found white powder of 8.6 gram. So that is basically heroin. CPC present, congestion of all the organs, petechial hemorrhages and cyanosis present all over the body. So what is the most probable diagnosis? Can anyone tell me? Yeah. So yes, Ashley, Menagdutta, you were right. So this is a classical case of body packer syndrome. So body packer syndrome is a condition where body is packed, the stomach is packed, intestine is packed with the small packets of drug of abuse, especially morphine, heroin or cocaine. So you can see here, this is the heroin pockets, and this is the one more case of body packer syndrome. The cause of death in this case is respiratory paralysis. Once there is a leakage from the packet, very large amount enters into the systemic circulation. As you know, opium, that causes respiratory depression. The cause of death is respiratory depression as a result of narcotic overdosage. The transport like this is a punishable offense under NDPS Act. Good. Body packer syndrome. Many answered. That's great. Now look at this. This is one more very interesting condition, the question number 4, basically. In question number 4, again postmortem, certain poisoning, as per 194 BNSS, a child, probably 10-year-old child. So on examination, what we found, there is a corrosion around the mouth, chalky white teeth, the black tongue. This is stomach. The stomach that is showing multiple perforation. Multiple perforation. So my question is, what is the probable poisoning in this case? So there is a necrosis around the mouth, chalky white teeth, black tongue, multiple perforation in the black tongue and the black stomach. What is the diagnosis, guys? So the diagnosis is sulfuric acid poisoning. So this is the case of H2SO4 poison or sulfuric acid poisoning. Okay? Yes, sulfuric acid, many answered. Okay, Kushi? Yes, good answer, good. That's great. Good. Many answered, Menagdutta answered. Sulfuric acid, that's great. Now question number 5 is very interesting, guys. The question number 5, इसमें क्या है? 22-year-old male with 10 to 12 episodes of vomiting, non-projectile vomiting, non-blood tinged, non-bile tinged, diffuse abdominal tenderness and the loose motion. His wife was very calm until her browsing history revealed that how to poison someone without smell. So what we can see here, the husband and the wife And you can see here rice watery stool. So that means it resembles like cholera. So बिना गंध के किसी को जहर कैसे दे? This was her browsing history. So my question is very simple. What is the probable poisoning in this case? So what are the clinical feature? Vomiting hai, non-blood tinged vomiting hai, then diffuse abdominal tenderness, loose motion like a rice water stool. Husband and wife, wife was having intention of killing the husband. Her browsing history suggestive of how to kill someone without smell. So what is the probable answer? The answer is arsenic. Rakesh, very good. So this is a case of arsenic poison. So arsenic poison. Arsenic is known as king of all poison. It's ideal homicidal. It's a colorless, tasteless, odorless compound which can be mixed with any food and drink. So answer hai arsenic poison. The fatal dosage is around 100 to 200 milligram. So it can lead to acute toxicity or a chronic toxicity. So raindrop pigmentation, then red velvety stomach, Aldrich Means line. The drug of choice is ball. Okay, so this is one interesting case. Yes, many got the answer. So good answer. Good. Ashley. Good. हो गया. Yes, arsenic हो गया. Charan Teja. Yes, fine. Question number 6. In question number 6, a very interesting case hai. Again, toxicology case as per the 194 BNSS. During police investigation, during autopsy examination, we came to know a 14-year-old female habitual intake of chalk pieces. So she was suffering from pica probably, came with a history of acute abdominal pain, distension, intense thirst before death, dilated loops of intestine, encephalopathy was present. Encephalopathy was present. Then also there was a history of peripheral neuropathy. Neuropathy. X-ray that shows some bands or lines. Then there is a bluish line at the gums and the teeth because of the presence of the lead sulfide. We call it as Burtonian line. So Burtonian line present, anemia present, basophilic stippling present. So what is the most important diagnosis in this case? Yes, guys. Yes, very good. Many got the answer. Sharan Tej got the answer. So this is a case of lead poison. Lead poisoning or plumbism, also known as saturnism. Again, the drug that is given is penicillamine. Penicillamine, or we can also give ball also. So lead poison, you will see microcytic hypochromic anemia, basophilic stifling, peripheral lead motor neuropathy, encephalopathy is very common. So, and commonly associated with pica, especially in children who are having habit of eating non-nutritive substance. So the answer is lead poisoning. So many got the answer. That's great. That's great. Good. That's okay. Chalo. The next question, the 7th question. Look at this question, very important question. Few drops, fatal months later. One of the very, very toxic poison which can enter through the skin. Have you seen this movie? a very famous movie, Dhurandhar movie. In that movie, I think you must have seen this this picture. What is this poison? Can anyone tell me? What is this? Come on, guys, try. What is that poison? Few drops, fatal months later. Presents with the chronic signs and symptoms. It resembles like natural disease. It causes slow death. Slow death. What is that poison? We call it as minimata disease. Okay, acrodynia, Pink's disease. What is the best answer? From the movie Dhurandhar. Thallium hai, ye kya hai? So this is basically dimethyl mercury. So which can enter through skin, even it can enter into the gloves also, rubber gloves. And when it enters the body, it causes multiple signs and symptoms. It affects the most of the organs, including brain. Nausea, vomiting, hair loss. So it causes nephrotoxicity. It causes signs and symptoms of CNS damage. It accumulates in the basal ganglia, which causes tremor, which causes erythism, which causes acrodynia, pain in the periphery. So resemble like metal fume fever. So what is this basically? Dimethyl mercury. So answer क्या है? Dimethyl mercury. Good, good answer. Yes, thallium, Rakesh, not exactly thallium. Thallium also a poisonous poison, one of the very toxic agent. But I think in this movie they were showing about dimethyl mercury. So yes, do you agree with me, Dev? Manak Datta, have you seen this movie Dhurandhar Part 2? I think in one of the scene they mentioned this dimethyl mercury. I think I do remember that. है ना देव? Okay, so this is about the question number 7. The question number 8. The question number 8, Manak Datta and others, there is a picture of umbrella. Umbrella is given. You can see here umbrella there. This is modified umbrella. In this umbrella tip, they placed some pellet consisting of some organic irritant. So this is very famous umbrella murder case. Can anyone tell me what was the agent used in umbrella murder case? In this case, they killed one very famous journalist, Marco. So by injecting some poison through the pellet with the help of modified umbrella, that is concealed murder case, they used organic irritant. What was that organic irritant used in umbrella murder case? Yes, so your answer is right. The answer is resin, basically castor. So it acts on the RNA polymerase. So it causes cell death. So it causes death within 3 to 4 days. And it causes CPC, congestion, petechial hemorrhages, and cyanosis. It can lead to brain hemorrhages, liver hemorrhages, kidney hemorrhages, lung hemorrhages, and death occurs in 3 to 4 days. One of the agent of bioterrorism, group B agent of bioterrorism, organic irritant. So this is resin. The answer is resin. Good. Many got the answer. Rakesh got the answer. Manak Datta, yes, dimethyl mercury they mentioned. Yeah, I remember that. Yeah. So all of you write in the chat box, umbrella is equal to resin. So write this in chat box. Keep writing. Then question number 9. Good. The question number is very interesting question. In this web series, very well-known web series known as Dahad, The Clean Murder and a Marriage Trap. It's a very famous case of murder by using some ideal homicidal agent. By mixing that ideal homicidal agent into the B complex tablets or the OC pills given to the female. So very famous serial killer. Okay, he is a serial killer in that movie. Serial killer. One who has to have sexual intercourse with the multiple females, and he is to give some OC pills after the intercourse, especially in the public place. And he is to kill many females by giving that, by causing histotoxic anoxia. What is this, guys? Can anyone tell me? Clean murder, marriage trap. Very good. So this is Cyanide Malika or Cyanide Mohan Kumar case. Good. What is this? Cyanide Mohan Kumar case. And just remember, in case of cyanide, we use 3 important drugs. What are 3 antidotes? Antidotes are sodium nitrate, sodium thiosulfate, and amyl nitrite. So this is very commonly asked. And one more point, this cyanide inhibits complex 4. And this complex 4 inhibits, so it causes anoxia and death. So the answer is cyanide poison. So many got the answer. Lily kit, that is okay. That's great. Mainakdatta, that's fine. Okay. And the last question. In the last question, there is a snake, and this is one of the most poisonous snake, very common in India, where you will see transverse bands. So steel black in color, you can see here, transverse bands are there. The fatal dosage 3 to 6 milligram, and which is neurotoxic, and it is also presynaptic. One of the most common snake, very cunning snake like Katappa. It has a tendency to bite people in their sleep without stimulus. So what is this snake known as? Yes, good. So this is basically neurotoxic snake. This is basically common crate. It's a common crate. What is the scientific name of common crate? Your answer must be Bungarus caeruleus. So the treatment is anti-snake venom. And the cause of death is respiratory paralysis. So the question can be asked, what are big 4 snakes? Big 4. So the big 4 snakes are, so they are basically common cobra, common crate, Russell's viper, saw-scaled viper. So as you know, vipers are hemotoxic, common cobra, king cobra, mamba and all basically neurotoxic. So sea snakes are usually myotoxic. So this is one very important funda and very important concept commonly asked in the exam. So Bungaru Ceruleus, good answer. So this is about the 10 questions along with a topic. So let's summarize all the poison once again. So this is the first case of poisoning. This is a case of fish poisoning, Tetrodotoxin, puffer fish. Okay. The second case is about the gopher killer, love failure case, and Opisthotonus, Purosthotonus, and Emprosthotonus. This is classical case of strychnine poison. Third case, when we see multiple packets within the stomach, meiosis, respiratory depression, then coma, probably diagnosis of opium, morphine poison, or diacetyl morphine, that is basically heroin poison. It's a case of body packer syndrome. Again, question can be asked, what is the difference between body packers and body stuffers? So third case. Then the fourth case, the black tongue, multiple perforations, chalky white teeth, corrosion effect. Most probable diagnosis is sulfuric acid poisoning, which is a corrosive. Gastric lavage is contraindicated. The fifth one, बिना गंध के किसी को जहर कैसे दे? The husband and wife story, king of all poison, rice watery stool, that is basically arsenic poison. So try to understand, that is raindrop pigmentation, Aldrich Mace line, which are features of chronic arsenic poison. And the sixth one, the classical case of pica, the overdosage of lead and the death, encephalopathy and the death, Bartonian line, anemia, basophilic stippling. So lead poison. Then the question number 7, few drops fatal months later. So the most probable diagnosis, that is dimethyl mercury, one of the most poisonous substance, Minamata disease. Then modified umbrella concealed murder case, the answer is organic irritant or basically castor poison, which inhibits RNA polymerase. Death occurs in 3 to 4 days. Then the question number 9, clean murder, marriage trap, basically cyanide Mohan Kumar case. 3 drugs are used in cyanide poison: sodium nitrate, sodium thiosulfate, and amyl nitrate. And the last one, common crate like Kattappa, which is a Bungaru ceruleus, one of the big 4 snake in India. Treatment is ASV. The cause of death is respiratory paralysis. The fatal dose is 3 to 6 milligram, presynaptic in nature. So Merra Gamesh is asking, sir, what is the fifth question? Fifth one. Chalo, theek hai? Haan. Fifth question is a very interesting question, beta. Haan. Look at this question. Yeah. Any doubt you can ask me in this. The clue in this question is, wife was calm until her browsing history revealed how to poison someone without smell. So the police came to know the offender, the criminal here is the wife. So she wanted to kill the husband just to resemble a natural disease. Her browsing history in the internet, in the mobile, in the Google Chrome, बिना गंध के किसी को जहर कैसे दे? That is suggestive of some intention, some methodology followed by the wife. What you can see here, vomiting hai, diarrhea hai, loose water stool is there. So it's probably a case of arsenic trioxide poison, one of the ideal homicidal agent, which resemble like natural disease, that is cholera. ठीक है, मैनक दत्ता, ठीक है, मेर्रा गमेश, समझ में आया ना आपको? ठीक है. Any other doubt? If you have any doubt, you can ask me for next 5 minutes. Okay. So what is the difference between body stuffer and body packer syndrome? Can anyone tell me? Body packers and body stuffers. What is the difference in postmortem examination? Australian, Menak Datta. What is the finding in body stuffer and also in body packer? In body packer, you will see multiple packets. Sometime 40, 50 packets. The main intention in body packer syndrome is the transport of illicit drug from one country to other country. In body stuffer, there will be few packets, maybe 2 or 3 packets. The main motive in body stuffer is to escape from the police. So what they will do to escape from the police? So just to conceal the drug in the house or in the room, they will just pack in a plastic cover, they'll just consume. So the packing is not that accurate. The packing is not clean in case of body stuffer, but in body packers, the packing is multiple packings with a great protection in body packers. But in body stuffer, there will be 1 or 2 packets, there can be leakage, high chance of leakage and death in body stuffer. So death chance is very high in body stuffer because of the improper packing. Body packers, death is very rare, probably because of the proper packing. Body stuffer and body, yes, good answer. Menak Dutta, Ashley Alien, great answer. Good. Now one more question I have. So this is okay. What is this basically? This picture in case of arsenic poison. This is stomach. Stomach showing some hemorrhage there. What is this? Any name given to this? Try. Ashley. Stomach in acute arsenic poison. So this is classical hemorrhagic stomach known as red velvety stomach. Red velvety stomach. Good answer. Few got the answer. That's great. This is okay. This is fine. Yes, this is also okay. So this completes our today's session. So let's come up with some more interesting cases in upcoming classes. Thank you all. Yes, what is your doubt? Alphos poison, ठीक है? Alphos poison. So alphos basically aluminum phosphate poison. Aluminum phosphate or zinc phosphate poison. Okay, this aluminum phosphate, zinc phosphate basically consists of yellow phosphorus. This yellow phosphorus is very dangerous. Even one tablet can lead to death. 500 milligram can lead to death. So it can lead to hepatic failure. Okay, so it's a very simple question. Aluminum phosphide poisoning, basically yellow phosphorus. Okay. Yes, game AMS, that's great. This chapter was not much of syllabus now. Okay. Okay. Fine. Okay, next class we are going to discuss in detail about Alphose poison. Yes, gamer, you don't worry, we are there to help you. So, AIMS Nagpur, that's fine. In next class, I'm going to discuss garlic smell. Yeah, garlic smell will be there in the breath also, even basically an opening the stomach. So, during postmortem examination, when you open the stomach, you will get garlic smell. So, garlic smell can be seen in arsenic poison, also in yellow phosphorus poison. So, okay. Yes, Alphose is used as a race grain preservative. One tablet, that can lead to death. And one more thing, it also produces poisonous gas also. So this poisonous gas can inhibit electron transport chain and sudden death also. Okay? In next class, we are going to discuss in detail about Alphose, fatal dosage, fatal period, how it acts, so and all with the images for better understanding. So time being, if you have any other doubt, you can ask me. Arsenic. Sir, Meesline will come in chronic. Yes, it's a good question from one of the student. Meesline, okay. Meesline. So meeslines are seen in chronic poisoning, especially in case of arsenic poison, and also in thallium poison. So example, this is the nail. So this is the nail. So in nail, you will see transverse white lines. Okay, transverse white lines like this. So this transverse white line is known as meesline, Aldrich meesline. So they are seen in arsenic poison, chronic arsenic poison, and also in the chronic thallium poison. In thallium poison, you will see neuropathy, you will see meesline, you will also see total alopecia and all. Okay? Thallium poison. If patient consume it, no other medicine can help patient. Okay. Yeah. Yes, treatment issue. I think you were asking about aluminum phosphide or Alphose poison. In Alphose poison, we give magnesium sulfate. So one of the very good antidote in Alphose poison is magnesium sulfate. Okay, good.